Good afternoon to everybody.
Good afternoon, everyone.
I'm Irina Bond, a well-aging expert, and here
I'm
is
Dr. Priyanka, gynecologist
at Hortman and Medi-Gyn. As promised, we are going to speak about insulin resistance today. Insulin, it's a very interesting topic, and we are all super confused, including myself. So let's talk about insulin, Dr. Priyanka. Why do we need insulin in our body?
Okay. So whenever you eat anything, for that matter, each food has something called a glycemic index. For example, if you eat ice cream, the glycemic index would be 100. You can see the scale then.
Quite high.
If you eat food with complex carbohydrate, like you have pulses, millets, protein, the glycemic index is low. As you eat or drink any, like a juice or a fruit or something like that, our body is going to release insulin from a small organ called pancreas. Pancreas is situated behind our stomach, okay, somewhere it's behind the stomach. Pancreas releases insulin so that the sugar that we are eating or any food that we are eating or juice we are drinking, whatever we are doing, the blood levels of the sugars remain stable. Ideally, your blood sugars should stay, fasting should be around 85 milligram per deciliter. It should not be more than 85 fasting ideally. And your after food or after you've eaten something can go up to 120, 140. Ideally, it should not, go really high.
Yes.
So that's the purpose of insulin.
Insulin is a regulator of glucose, of sugar in our body.
Yes.
Okay.
So whatever you're eating, your body is going to keep releasing insulin. It's a
to manage it.
Hormone which is vital for life. We cannot live without insulin.
Yes. And insulin is a hormone. Let's be clear on that.
Yes. Insulin is a very important hormone. It's going to control your sugars. Now, if you are eating too many meals or you're eating sugars with high glycemic index, your body's sugars are increasing. The job of insulin is to make sure the blood glucose is normal.
Yes.
So this extra glucose or any kind of glucose has to go inside our muscle cells, the cells in our muscle, in our fat, in our liver. Especially the liver is going to take the burden of all the extra sugar that you're taking.
Yes, because it needs to process. Liver is responsible for body detoxification.
I will take this opportunity to say each bottle of your cola has around 18 grams of sugar. And you can imagine how much sugar is going inside. It's almost 4 to 5 spoons of sugar.
Yeah.
And all the extra
incredible
sugar,
amount.
All the sugar goes into your liver, and then this liver is trying to keep, taking up the glucose to keep the blood sugar normal.
Yes.
At one point of time, the cells in our muscle, in our fat, in our liver are so full of sugar that no more insulin cannot, they
cannot bear it anymore.
So the cells become so full of sugar that then there is a key on the cell which helps the insulin will work on the receptor or this key on the cell to help the glucose go inside. After this time, the cells become receptor. They change the receptor. So the insulin cannot act on the cells, and that is called insulin resistance. So your sugar keeps going high. But insulin is so high that insulin is now not able to push the glucose into the cell.
Yes. So insulin is actually very
it's like a key.
low in the body then to manage the sugar. So it doesn't manage anymore.
So the insulin levels are naturally the body starts to make more insulin. Because whatever insulin level is there in your body is not able to push this glucose into the cells.
Absolutely.
Hence, your body is making more insulin, and as the insulin levels keep increasing, fasting levels are high, your after food insulin levels are high, that is called insulin resistance, and all of this extra sugar then starts storing as fat. Or all this extra sugar goes into your liver, and that is what nowadays we are having cases of non-alcoholic they call it NASH, non-alcoholic steatosis of the liver, or hepatitis. That means the problem in the liver because of extra sugar. So all this sugar is settling down. So alcohol is not causing as much liver disease nowadays as
the sugars from any foods.
Yes, what we call as fatty liver.
Fatty liver.
Yeah, so fatty liver, if you do ultrasound, is so common. Most of the people are having fatty liver and they are just told, okay, it'll be fine. But slowly, it's like a slow poison.
Yes.
And this sugar, which because of your insulin resistance, insulin is not working anymore. Insulin also increases the male hormone, especially in women. Testosterone increases, and that causes polycystic ovarian syndrome and the hormonal problems.
And so on and so forth, and the whole cycle begins.
And then you have, extra fat getting deposited on your belly.
And that's what the belly fat comes. Okay.
Yes. So that is what, when anybody is coming to us with belly fat, especially women who are, getting into perimenopause after the age of 40, our body is in fact storing more fat, so that as the hormones are coming down, this fat is going to make more hormones. So the belly fat then becomes very hard to get rid of.
Wow, interesting. So what is our proposition, Dr. Priyanka, in terms of for these types of conditions?
So we have women who face issues with these hormone imbalance, insulin resistance. So when they come to us, we either do a fasting insulin for them. So the fasting insulin also, the values range from 2 to 20, but optimum would be 6.
Exactly.
And after food, it should go maybe up to 25 or 30 and come back. But when we do the insulin resistance test, in which we do the fasting insulin, then we challenge the body with a glucose solution. And when you check after 1 hour and 2 hours, I'm finding the insulin levels to go as high as 200 and 300. That means once there is a challenge, means whenever you are taking glucose, your insulin levels go so high. And this insulin resistance, high insulin levels are increasing your fat cells in your body, and it's a cycle which goes on and on unless you find a way to break it.
Yes. So how do we break it then? We do the hormone balancing program.
Yes, we do hormone balancing program. We have very bespoke supplements, which are, natural supplements like berberine, inositol.
That can stabilize, that can stabilize.
These help stabilize our sugars. So these are, they are called insulin sensitizers. Sometimes we need to use medications like metformin. So these are medications, and then you have all these, injections which have been used for.
Would we use metformin right away, or would we try with as natural supplements as possible and then metformin?
So that's a very good question. So we always have to do a deep dive into your blood tests. What is your lipid level, your cholesterol levels, your insulin, your cortisol. Understand what your hormone levels are. So there is no quick fix. Unfortunately, right? So if I just say go lose weight and come, I don't think that makes sense to anybody. In 3 months again, the patient will come to me.
The same situation.
They will gain more weight and come. So what we focus now is tell people that don't focus on weight loss. Focus on muscle building. Focus on exercise, of course, but very specific exercise like weight training, weights. Go to the gym, try to find out ways in which you are improving your muscles. Change your diet, whereby you are maybe trying intermittent fasting, but again, do listen to your body as to what your body is doing.
Because everybody is different, everybody is individual.
Or at least what I do is I at least keep a 12-hour window. If I've had a late dinner, I try to have my dinner by 8 or 9. But if the dinner gets late, then at least your breakfast can be 12 hours later. At least try to keep the gap of 12 hours. And then start your day with a good quality protein.
Yes, absolutely. And why is that? Because protein stabilizes blood sugar levels
for longer. So I would not say go on this kind of diet or that kind of diet. There are different kind of diets circulating all across. Do not calorie restrict yourself too much, because if you have a very, very low carb diet, again, your body is going to preserve the energy. So your weight loss journey will not happen. Right? So you have to be wise. You need to have help from someone who can help you with your meal plan and make it very simple for yourself.
Yes, exactly.
So start your day with warm water, with some lemon. We advise women to
flush all of these toxins out of your body first. From the night before.
You have anti-inflammatory like cinnamon, you have apple cider vinegar. So it all depends on how your body, is responding to different kind of anti-inflammatory.
Try different things first.
Supplements, But kind of start your day with a detox, with a glass of warm water. Don't jump into the tea and coffee immediately.
Exactly.
You postpone your tea or coffee to after your breakfast. Have a hearty breakfast where you have either oats or whatever it is that you take, but restrict the carbs or have the carbs at the end. So start your day with fruit. I recommend to add some nuts because nuts again have healthy fats.
And nuts are proteins,
Yes.
so you could stabilize your blood sugar levels
Eggs, yeah,
immediately.
cut down process. So any diet change also needs to have like a program. If you jump
Absolutely.
in and stop everything at the same time,
It doesn't work, and you
will not
are
work.
getting unhappy, and
then
it
you're
will
taking
restart.
your chocolates and your sugar
Yes.
rush, and then you're going again, going to
Yeah.
the guilt trip, and it just goes on and on.
Yeah, absolutely.
But having the knowledge that, okay, I probably have some insulin resistance, I probably have thyroid antibodies, or I have some kind of inflammation or gut issues, or this is where. So having that knowledge, having that information is important. And then you look at, not just 1 month or 2 months, you look at months and years ahead of
Yes.
healthy life.
Absolutely.
That's important.
It's not gonna happen within overnight, but it will happen if you take a reasonable step forward and do it every day, just a little bit.
Yes.
Just a
you
little
don't-
bit
You
more,
don't even
and a
need to
little bit
spend time like hours in the gym. Even simple 15-minute workouts, or just simple touching your legs, or workouts for your tummy, workouts for your upper body. Start working with weights, and that's how you make
Yes,
a plan.
exactly. But always workouts, and also adjust your foods
Food.
also.
So it's always 30% diet, 30% your exercise, and 30% is the medicines, and
Yes.
then the supplements. So when we have your numbers, we have done your test for insulin resistance, we have done your thyroid antibodies, we have checked your cortisol, your hormones, your estrogen, progesterone. We understand, okay, maybe you have a high estrogen state. We're going to talk about estrogen dominance. Yeah.
Yes,
Your
next
body
time.
doesn't have enough progesterone, or there is some other imbalance which is happening in your body. So only when we test for it, we understand.
We
what it
understand
is.
a little bit more, and we'll be able to help you a bit more.
And
So
that's because we have, and of course, then you have medications nowadays to help with the weight loss. So what these medicines also do, the injectables, basically we have two kind of hormones. Again, appetite stimulating and appetite suppressing hormones.
yes,
So we have leptin and ghrelin. These are the two hormones. So leptin is the hormone which will, increase your satiety.
I see. Okay.
And why
Interesting.
is our brain not making enough leptin? Because we are not focusing on our food.
Yes, we are swallowing our foods.
We are not looking at our plate of bliss that we have in front of us and say, okay, I have my fish, or I have my lentil, or I have my rice. Eat white rice, eat whatever you are grown up eating, no worries. But at least enjoy the meal that you're
Yes.
eating.
Yeah,
It
in a
should
peaceful atmosphere.
take at least 15 minutes to sit down without your mobile, without your iPad,
Yes.
without your work Zoom call on your head. Sit down and chew and munch your food,
And
my mom
enjoy
keeps
it,
telling me
yes.
I don't do that, right? But I have maintained my weight because of my, I'm a little more aggressive with the exercise. But even I sometimes don't sit down and chew the food and,
Yes.
So then how do you get the satiety? So usually when you start eating, have a mental, we call it mental
Preparation.
meal map.
In
Take
a
a smaller
way.
plate. Start with your salad.
Yes.
Yeah, even if you're eating your burger, no worries. Start with salad. Eat it slowly.
Yes.
So when you eat the fiber, that will prevent the bad fat from getting absorbed.
Absolutely.
And then have your carbs last.
Yes.
And even if you're sipping on your cola once in a while, have small sips.
But
Don't
once in a
gulp it.
while, try to do it once in a while.
Don't gulp it down like, because as if you sip on a juice also slowly,
Yes.
that's what happens if you are, say you have an orange. If you peel an orange and you eat an orange, then you are eating slowly, the fiber is going in. And the same
Yes.
3 oranges, even if a fresh juice you're taking, you are gulping it down, your liver is not able to manage so much of sugar load.
Absolutely.
So I always
Absolutely.
advise people, eat the fruit. Try to eat fruit rather than, juice the fruit. That's always
Absolutely.
important. So these are small tips which, you can
You
start
can
trying.
implement into your diet, into a daily diet, step by step. Not all at once, maybe, but step by
For-
step, and you will definitely see the results down the line.
And clean your, clean your kitchens. Make sure
Yes,
that
make sure that
have
you don't have any snacking going on over
too
there.
much. Yeah.
Too much.
Yeah.
Exactly.
Start slow. Maybe start slow.
Yes.
Okay. So if you like, say you like some biscuits or something like that, buy the smaller packet.
Absolutely.
All right. Don't buy the bigger one, so you're tempted to finish it. All right.
Yes.
And maybe
the less you have, the less you will be tempted.
reverse the way you do your grocery shopping.
Yes.
At the billing counter is where they will keep most of the stuff which is not too good for us. So go to the other direction. Go to vegetables and the fruits first.
Yes,
and,
yes.
And start try. There are 800 kinds of plants available.
Absolutely.
To eat. So try to get your diet more plant-based and work on it.
Busy Dr. Priyanka. And also, last but not least, make sure that you do your food shopping while you are already full than empty, because on empty stomach we are capable of buying the whole shop and perhaps even eating it
And
also.
maybe have a big bag like you have, right? And put those boxes with nuts and things like that.
Yes, exactly. And carry something with you. If you are super hungry, you can snack a little bit, but not too much. And go about your
If
business.
you want to know more about insulin resistance and about metabolic health and about hormone balancing, do visit us.
Or if you have any issues at this point in time, right away, please
us a
do
DM.
DM or email us, and we will be happy to send you our plan, our hormone balancing plan, where we explain from A to Z what we do, and we will be happy to assist you. So thank you so much. Thank you, Dr. Priyanka, for explaining it all to us.
Because we are looking at longevity.
Exactly.
The next, not just couple of years.
Not just a couple of years, but good.
As long as you want to live healthy.
30, 40 years, exactly. And not healthy and active life. Not just long life, but we want to be active. We want
Health
to live.
span.
Yes, health span rather than just lifespan, right? Thank you so much to everybody. And we...
Do you have any questions?
Do you have any questions at all?
We have a couple of people have joined, but no questions today.
That's
It's
okay.
a
You
weekend.
can
People are getting ready for the treat.
For the weekend, for the treat, yes. DM us if you have any questions, and we will be talking about estrogen dominance next time, next week.
Tuesday.
See you soon, and have a great weekend. Bye bye for now.
Bye-bye.
Bye.